This is Joshua Honrado, and I will be presenting on my quality improvement project, which focuses on the experience of the athletic training student within their clinical setting. As a young professional within the athletic training profession, I have the unique opportunity to mentor athletic training students within my work setting of performing arts. With 6 years of sports medicine experience as a student and 4 years of professional experience working within the performing arts setting, I know I have a very specific skill set and clinical knowledge which athletic training students would not be able to learn within the classroom. What I do not know, though, is whether I'm effectively disseminating this clinical knowledge and providing the best clinical experience to the students that I do get the opportunity to mentor. This is the quality gap that I will be addressing. The general goal of my quality improvement project is to implement a system in which preceptors and athletic training students are able to measure a student's personal clinical growth within the clinical setting. We know through research that there are ways in which preceptors are able to provide better education to athletic training students. By providing responsibility, accountability, and authority to the athletic training student, preceptors are able to promote empowerment to the athletic training student through open-ended questioning, feedback, and joint decision-making. Implementing these strategies within teaching moments can help facilitate learning and growth, but this growth isn't necessarily measured or known. The primary team members that will be involved within this project include 4 ATC staff within the Harkness Center for Dance Injuries who will be interacting with the athletic training student. The ATC staff, by the end of the fall 2018 semester, will guide one athletic training student in becoming more clinically confident within the performing arts setting, and the student will measure their confidence through biweekly outcome assessments. Other Harkness staff, the clinical coordinator, and the patients that the athletic training student will interact with as well play a role in the student's overall experience. The aim statement for this project is as follows. Implement a biweekly student-reported outcome assessment and obtain 85% completion with one athletic training student within a performing arts clinical rotation during the 2018 fall semester. In order to understand the intricacies within this quality improvement project, I have created a flowchart as well as a fishbone diagram to help illustrate the processes and organizational structures involved. Starting with this flowchart. At Harkness, we accept one athletic training student per semester to intern with us. Students seek out clinical opportunities specific to the performing arts, and they find out about Harkness typically through online searches or through word of mouth. Once a student reaches out to Harkness, they undergo a formal interview process in which 4 full-time athletic trainers interview the athletic training student to make sure that they are a good fit to be an intern with Harkness. If for whatever reason they are not deemed as a good candidate, they are later notified of their rejection. If they are approved by the Harkness staff, the athletic training student as well as their school is notified of their acceptance. Contracts between the athletic training student's school through a clinical coordinator as well as the hospital are created and agreed upon. During this process, the clinical coordinator as well indicates any required competencies and assessments of the student's performance that need to be completed. On the first day of the student's clinical rotation with Harkness, the student receives a detailed orientation of the logistics and expectations of the student. If the student's personal, professional, and clinical goals are not established within the competencies required by the school, a discussion of these goals occurs. Halfway through the internship, evaluation of the student's educational and clinical progress occurs through a midterm check established by the athletic training student school. If personal, professional, and clinical goals are not addressed within this midterm, they are discussed. At the completion of the student's clinical rotation, evaluation of the student's educational and clinical progress occurs through a final check established by the athletic training student school. If personal, professional, and clinical goals are not addressed within this final, they are discussed. Evaluation of the athletic training student's overall growth is discussed. Utilizing the flowchart, I selected people, policy, process, and materials as the main branches within this fishbone diagram to describe the outcome of there being no student-reported outcome indicating an athletic training student's perception of clinical and professional growth. The primary people who interact with the athletic training student are the multiple clinicians that the student observes and shadows under. The clinical coordinator of the athletic training student school provides a pivotal role in providing the competencies and educational requirements of the student. The variable patient population that the athletic training student interacts with plays a role in the student's learning and growth. There are no policies or requirements in place for the need of student-reported outcomes. Evaluation of student performance are primarily educational and clinical competency-based. The formal process of evaluation of student performance typically consists of a midterm and final. Constant communication of the student's perception of their performance is performed throughout the internship. The materials to evaluate the athletic training student's educational and clinical performance are provided by the school. The student self-tracks their attendance and personal goals that are not specified by the school. There currently isn't in existence a measure of whether or not students or interns feel like they are benefiting or learning from clinical affiliations. Teachers and preceptors are able to measure and provide a grade of a student's performance based on whether the student or intern passes a set of standards established by the athletic training student school or intern's affiliated organization. These standards may not correlate with the student's specific personal goals and priorities. I plan on utilizing a modified version of the patient-specific functional scale, which is a validated patient-reported outcome measure, as a means of having the athletic training students self-assess what they deem to be important limitations to their professional development, and to measure their growth within these limitations during their clinical affiliation. Even though this tool is created and validated for use with patients with functional limitations, the brevity and open-ended nature of this assessment would be perfect for students to self-select what personal goals they would like to work on within the clinical affiliation. They will work with their primary preceptors in order to determine if their personal goals are measurable and accomplishable within the clinical affiliation. This assessment will be a good way to determine whether or not the student or intern has improved with these goals by looking to see if there is any detectable change. For this reason, it can be seen as a process measure, which will be the focus of this quality improvement project. The outcome measures that will be included within this quality improvement project will include the number of patients the athletic trainer student is able to treat as a primary provider. This number will be calculated on a weekly basis. As a sole process measure, the modified PFPS will provide a numeric value in terms of change with the personal goals selected by the athletic training student. Trends within the scoring will be analyzed. The PFPS does have an associated minimal detectable change value, but since this assessment hasn't been validated for the purposes of this quality improvement project, this value cannot be utilized. In terms of structure measures, these values can be obtained based on how many times the athletic training student completes the patient-specific functional scale. Going back to the outcome measures, the change in number of patients the athletic training student is able to treat as a primary provider will indicate either an increase or decrease in clinical growth. Different components within the Plan Do Study Act cycle have been previously mentioned within this talk. In addition, within the Do section, documentation of compliance and completion of the modified PFPS, as well as any barriers for the clinicians in the administration of the modified PFPS will be noted. Within study, comparisons of the outcomes within the modified PFPS indicated by the student can be compared to the student's educational grades and competencies. Based on the findings from this quality improvement project, the modified PFPS, or a different student-reported outcome assessment, will be administered to the next athletic training student. Additional measures may need to be taken in order to increase completion compliance of the student-reported outcome. This cycle as well will help in preparing the next athletic training student creating better or more realistic personal goals, as well as aid the preceptors in modifying teaching styles to better suit different learning styles. Through a couple of cycles of this quality improvement project, A solidified and validated student-reported outcome assessment will hopefully be developed. This SROA will then be passed on through word of mouth to athletic training students who are interested in a way to measure personal clinical growth. It can then undergo a trial and implemented within an athletic training educational program as part of the standard midterm and final evaluation. With data and completion of multiple athletic training students who have utilized this SROA, a workshop on integrating the SROA at an Eastern Athletic Trainers Association meeting can be provided. If successful, a similar workshop could be provided at the National Athletic Trainers Association annual meeting. Thank you for your attention, and I welcome any comments or suggestions to this quality improvement project. As a parting gift, depicted are the 4 different generations of athletic training students that I have had the privilege of being a preceptor for, and the different staff members a part of the Harkness team. Thank you.